Hi, I'm Dr. Sasha Obey, the Medical Director for North Texas Plastic Surgery. And I'd like to take a minute today to visit with you about the choice between a round breast implant and an anatomic or teardrop-shaped breast implant. Both implants can give you amazing breast augmentation results, and the choice of which implant is right for you really comes down to a combination of your goals and what you are starting with. The advantages to a round breast implant are simple. Round breast implants are going to give you the most fullness at the top and the most cleavage possible. When a patient tells me that they want the maximum amount of cleavage that I can deliver for them in their dresses, in their swimsuits, etc., I will recommend for them a round breast implant, knowing that this is really going to maximize their fullness at the top. The other advantage to a round breast implant is that very rarely in the body over time, the breast implants can move or shift a little bit. When a shift occurs in a breast implant that's round, there is absolutely no effect to that because it looks the same whether it's oriented the way it was originally or whether it was turned 15 degrees on its side. Anatomical implants, or teardrop-shaped implants, were designed to give a more natural appearance to the breast. In other words, they were designed to be less full at the top and more full at the bottom, as natural breasts often are. The advantage to selecting an anatomical shaped implant is that you will have a much more subtle breast augmentation result. If a patient comes to me and says they want their breast to be a little bit larger, but they don't want anyone to know that they've had breast augmentation, I'll oftentimes suggest to them considering an anatomic shaped implant. That'll give them much less fullness and roundness at the top and much more of a teardrop shape to the breast. Furthermore, there are some patients who start with a different shape to the breast. Specifically, they have a very tight fold on the bottom of their breast. If you have a very tight fold on the bottom of the breast, that can cause the breast to have an abnormal, almost cone-like shape. Placing an anatomic breast implant in there will preferentially push against that tight fold on the bottom of the breast and can help round that breast out and make it appear more natural. For patients that have a very tight fold to the bottom of their breast, I will also often recommend an anatomic or teardrop-shaped implant. Both of these implants are made by the same manufacturers and are extremely safe. The question and the choice between round and anatomic implants really comes down to your goals. If you want the maximum fullness at the top, I would select a round breast implant. If you want the most subtle, natural appearing breast augmentation result possible, I would consider an anatomic or teardrop shaped implant.